Why did I lose facial volume after laser radiofrequency treatment?
We are continuously seeing people who are distressed by facial volume loss after treatment with thermal energy devices. This reflects a growing trend in the aesthetic field. I feel that thermal or skin heating devices, such as the various branded laser and radiofrequency technology, are often aggressively promoted as substitutes for surgical procedures such as facelifts and neck lifts. Although these devices can modify the skin through collagen stimulation and remodeling, which can be beneficial for facial aging, they are not in any way replacing surgery. I've observed the effects of these devices being overused for people who are not candidates for this type of technology, yet these devices continue to be aggressively and deceptively marketed as alternatives to surgery. In the state of New York, people who perform lasers and radiofrequency device procedures do not have to be licensed physicians or nurses. This means that unlicensed individuals can perform procedures which can permanently change and even damage your skin. Regardless of who uses these devices, improper and overly aggressive use can cause facial volume loss. I'll discuss the role of laser or radiofrequency technology in my practice and how you can understand the indications for this technology so you don't overcook your skin. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years. I started using fully ablative CO2 lasers in the early 1990s. Since that time, I've continued to use light and radiofrequency-based technology in my practice to help people improve the appearance of their skin. Prior to the introduction of the CO2 laser, the gold standard for treatment of lines, wrinkles, and skin discolorations was chemical peels. With chemical peels, whether superficial, medium, or deep, there is an ablation of different levels of the skin with regeneration of new skin. A certain amount of collagen was created in response to the peel, which then improved the skin texture, quality, and color. The benefit that CO2 lasers have over chemical peels is a skin tightening effect caused by thermal energy delivered to the skin by the laser. The idea behind laser treatment is to apply a specific amount of heat from a laser device to cause the skin to contract and to induce collagen production through a controlled injury response. These principles are relevant when treating the skin, which is about 2 millimeters in thickness. There is a general perception that facial aging only affects the skin, which is why anti-wrinkle creams and skin procedures are so popular. The reality is that facial aging is more significantly associated with bone loss and weakening with sagging of the supporting soft tissue. In clinical practice, I've often seen people in their 40s and 50s who feel that they may need some type of tightening procedure. This is because they pull upwards on the cheeks and show me how they look better. The basis for this perception is that soft tissue volume is being repositioned through this action and improving the appearance of areas where volume has been lost. In my opinion, neither surgical lifting nor heat-induced skin tightening is the optimal approach to this type of situation. If there is volume loss, you restore volume. However, it's important to restore volume in the most anatomically beneficial way. Volume loss is managed by the placement of injectable fillers. In my practice, I prefer the hyaluronic acid fillers, such as the Restylane and Juvederm family of products. Traditional placement of fillers is within the skin at the level of the dermis or just below the skin. I approach facial volume loss differently. Since a significant amount of volume loss is at the bone level, I perform a procedure called structural volumizing. This method is based on applying the principles used for the placement of facial implants, such as cheek and chin implants. These implants are routinely placed on the bone and below the facial muscles. As a surgeon, I've performed many of these procedures and I'm familiar with this space. I place long-lasting fillers such as Juvederm Ultra Plus or Juvederm Voluma to restore volume at the cheeks, chin, and jaw angle. This method of restoring volume lost by aging is much more impactful than any thermal energy procedure. Once you understand this principle, you'll recognize why heating up the skin makes no sense when the underlying issue is the facial bone volume loss. For people who are in their 50s and older, sagging of the supporting tissue called the SMAS and platysmal muscle results in jowls and loose neck skin. The optimal procedure for this type of situation is a facelift or face and neck lift surgery. This group of people is particularly susceptible to the false promises of thermal-based non-surgical facelifting. In addition, at this time of your life, your skin is thinner and the layer of youthful fat under the skin continues to diminish. In my practice, I help many people over the past 2 decades overcome their fear of facelift surgery by performing these procedures in my certified office operating facilities under local anesthesia with light intravenous or IV sedation. By avoiding both general anesthesia and institutional facilities such as hospitals where you can feel like a number, my patients are able to undergo more definitive surgery with quicker recovery. The science behind thermal-induced collagen remodeling as well as thermal-induced fat reduction is sound and can be effective. The problem is that people who are looking for a solution for volume loss and deeper tissue sagging are being sold procedures which don't deliver and often result in making you look worse than you did before. It is often the case that after a thermal treatment is not successful, the practitioner will often dial up the heat intensity or prolong heat exposure to the skin. Excessive use of heat or prolonged exposure to thermal energy devices can result in loss of fat below the skin. A layer of fat under the skin is important for the appearance of smooth and youthful skin. This means that the treatment makes the skin end up looking older. Other complications include skin burns, blistering, scarring, and prolonged redness. During consultation, it's routine for patients to ask me about different devices which they hear about. I suggest to them to first take an overview of the problems which concern them before determining the options which suit their needs. I take an inside-out approach. This means understanding the presence and extent of 1. Bone volume loss, 2. Soft tissue volume loss, 3. Support tissue and skin sagging, and 4. Skin quality in terms of wrinkling, discolorations, and vessels. Based on understanding of the potential benefits of thermal energy devices in improving skin thickness and smoothness, I developed strategies to achieve these goals with significantly lower risk. We use a variety of lasers in our practice, such as fractional CO2, fractional erbium, ND-YAG, Q-switch, as well as radiofrequency devices such as Pelave. When it comes to aging skin, there is usually a combination of issues such as wrinkles and discolorations. If we focus on the typical objectives of a therapy, which is to both stimulate the production of new collagen and improve the arrangement of the collagen bundles so skin looks younger and thicker and more even, then we could look at all the ways these objectives can be achieved. We should also factor in what is the potential capacity of a person's skin to produce collagen. This capacity to produce collagen will be limited by factors such as age, sun damage, smoking, and previous treatments. For many people who come in for consultation, they've previously had chemical peels, lasers, and radiofrequency treatments. This means there may be no effect or benefit from thermal energy treatment or even potential breakdown of the skin's integrity. This is why a proper examination by a highly experienced physician is important before signing up for a treatment. In my practice, I routinely combine technologies to improve the skin. Let's consider a common situation, such as skin affected by chronically excessive sun exposure and aging. For the fine lines, I use fractional and fully ablative erbium and CO2 laser. For discolorations, I use a Q-switch laser. For dermal thickening, I will use limited heating with long-pulsed erbium as well as Nd:YAG laser technology. The technology used with long-pulsed Nd:YAG can be used for both skin remodeling and tightening as well as fat reduction. For many patients, I will also do a procedure called skin boosting. This is where I combine PRP, or platelet-rich plasma, combined with hyaluronic acid and use a device to deposit this mixture directly into the dermis. And this is done without any bleeding or bruising. This combination will stimulate the collagen production and improve the skin without heating. Many people who come to our office upset and angry about facial volume loss from overuse of a thermal energy device performed elsewhere are relieved to have a rejuvenated appearance by a rational approach from the inside out. Most often, a combination of structural volumizing with skin boosting and an epidermal treatment such as hydrofacial results in a natural and improved appearance. Deceptive and high-pressure marketing in the aesthetic field is not going away anytime soon. The key is to find a doctor you can trust and who you feel understands your cosmetic concerns to help you look your best. I hope you found this information helpful. Thank you for your question.